And some of your work during this pandemic has been what?
Well, we reached out to the governor before the 1st of August to ask him to push for virtual learning rather than either virtual learning or traditional. And we didn't hear back, but we did a lot of media on that. And since we didn't get any feedback on that, and watching the daily reports of deaths, school open, within 2 to 3 weeks, we had more than 2,000 students at home in quarantine. We have more than 800 teachers at home in quarantine. That is serving no purpose by having traditional schools. So you want to know the difference? Those districts who are smart enough, they opened school and saw what was happening. They closed school and they went to distant learning. A lot of the districts, when the governor was making his report, said they were doing traditional. And in his report, he said they did not have a safety plan in place, but he hoped they would put one together soon.
Wow.
So it's so much going on. And with the traditional learning, we're putting our teachers and students at risk. And they are looking at the other schools where the students and teachers are not exposed to COVID.
Now, do you know what the percentage of districts that are now that we know that this was not a good idea to even consider the idea of the possibility of in-person, what is the percentage of the districts that are now virtually learning versus traditional learning?
We don't have that data right now, but we do know that 71 schools within 71 counties in Mississippi have COVID. So that meant there are schools within the 71 counties that are traditional, that are open and allowing students to come in. In some cases, our teachers, our members are complaining that they don't have to have, in some schools, the students don't have to wear a mask in the hall.
Wow.
When they're teaching class. In other situations, we have students who are sitting maybe 2 feet apart and they don't have to have a mask on. So it's a lot going on in the traditional setting that those who are coming in with the virus can't help but spread it.
Well, on a state level, the schools that have opened and have days where they're doing traditional learning, is there somebody on the state level that has been commissioned to be able to monitor these schools and their safety procedures?
That's the sad part about it. There is no oversight committee. It's left entirely up to each school district to do it their way. There's no oversight. And you can't have, and when we look at it's about 895 today cases reported and 25 people died. What I'm saying to the governor and to the State Department of Education, someone needs to have an oversight, close the schools for now. It's not permanently. When we drop our 23% positivity rate in the state to under 10, then we can start talking about it. But Willie, I'll just say this. If the way to avoid and safeguard everyone from the virus is to safe distance, wash your hands and wear a mask, and stay home when it's possible, why are we opening up our schools?
And putting our children and our teachers, I know we think a lot about
it. That's what I said. Why are you putting the students and teachers at risk?
And the rest of the public, because when that spreads within the school system, then it's going to be spread within our communities.
And you don't have quality contact tracing.
Right, exactly. And now JPS has decided to go with all virtual learning. Is that correct?
Right.
Okay. And that's going to last through the first semester? Is that what we're...
Right, through the first semester. Some school districts that have gone virtual looking at it for the first 9 weeks, and then they make a decision after that.
Yeah, and that makes sense. That makes real sense, because we can see what's going to happen, because on a national level, they're telling us to prepare for something in the fall. or a possible spike in the fall. So it gives us an opportunity just to be careful right now. Let's see what happens. Let's see how we're getting the numbers down, and then kind of go from there. And we might even need to look at the idea of a virtual learning for this entire year. And yeah, and I would say too is let's spend our energy and time building the supports around teachers and parents to be successful virtual learners and teachers. And that may be the focus. And I know we've given some support to the teachers, some support to the parents. What I'm hearing from some of the parents is that a lot of the information around virtual learning and education that they've been getting has been very complicated. They've, it's been they've been trying to get it figured out. So I don't know if we've done as much as we need to do around that. How are the teachers feeling? Are they feeling prepared for virtual learning?
Well, one of the things that AFT is doing is we are preparing professional development to help teachers through this, so that they'll be able to do their lessons virtually, wherein you're keeping the students' attention, they're enjoying it, they're learning from it. But here again, we have to have parental support in that household. We have to have equipment for the students. And when you hear that it's been ordered, but it hasn't arrived, it will not be here till October, what are the students supposed to do with virtual learning from now to then?
Yeah.
The state did not take this serious in March because they had beginning the end of March to the 1st of August to set this in place because it's a deadly disease. It's not a do-over. And they didn't do it.
Now, what do you want from us as a community? How can we support this effort? What do you want us to call on? What is our call to action from the American Federation of Teachers?
Call to action for parents and community leaders is to push the governor to issue a statewide mandate for all districts to go virtual at least the first 9 weeks. Give them a chance to get their schools ready, get the ventilation system going, and get the numbers down. As I listened to the governor today, put out a state mandate on how to go to football games. But he can't do a state mandate to save the lives of teachers and students. That really bothers me.
Yes. I think I have Miss Pauline Rogers in the room. Miss Pauline, do I have you in the room? Hey, Miss Pauline, how are you? Well, I thought I had her. Miss Pauline, are you still with us? Yeah, there you go. Miss Pauline?
I am. I've been having all kind of technical problems.
Okay. Yeah. Well, we're going to get you just a couple of minutes to get totally in the room with us. Thank you for joining tonight. How are you doing?
Fine. How are you?
I'm doing well. It's always wonderful to see you. And we're talking tonight with Miss Dr. Geraldine Bender, who's president of the American Federation of Teachers, and Miss LaWanda Harris, who's the chairwoman for Jackson Municipal Airport Authority. And we just finished a brief conversation talking about where teachers and students are around virtual learning and traditional learning, and also the safety of our children. And so now, Dr. Bender, that we are going virtually here at JPS. We got, of course, other districts who are doing a little bit of both. What is the status of bus drivers and cafeteria workers? Are they being laid off, or what is? I mean, are we continuing to pay those individuals? How are those individuals getting by and surviving?
The cafeteria workers are preparing the meals that the bus drivers are taking to their bus stops.
Okay.
So they are still hired.
Okay, so they take the meals to the bus stop and the children comes and get the meals?
Right, where it's virtual. They give a time that the kids need to show up. Actually, someone in the family will have to come and pick it up if it's not right in front of their homes.
Oh, okay. That's wonderful. That is wonderful.
And then the custodial staff, of course, is keeping the buildings clean. Security is there, so they all still have their jobs.
Okay, wonderful. That's good news. And then how are teachers handling the virtual versus traditional? Are they getting to a point where they're getting a little comfortable with it? I know that there was a little bit of opportunity before the summer began for them to get a taste of this virtual learning and virtual teaching. How are they doing? Are they feeling comfortable with it yet?
Well, some of them are, but some systems are not working. Parents are not able to get quality. It's still not working in a way that you walk in, click the computer on, and everything is working. Not for all of them. So they still, getting the kinks out? But they're managing.
And what do you recommend for parents? Or do you have a call-in number if they need help and support? What are you saying to parents?
The best thing you can do is let school district know that you're having a problem. Find a way. If you can't email, go to the school and let them know if you're having a problem. There's homework going on. There is virtual lessons going on, but there are no guides for the parents to be able to help the children work through whatever the problems or the workload that's being sent home. And so we need to, I guess, hopefully get the message out to all the educators who are doing Zoom, who are doing virtual learning, that when you send out a lesson, there should be a guide that the parents can get to help their students, because otherwise they're not going to be able to do the work.
And I think for many parents, because we know even JPS have always struggled with technology and having sufficient technology around our children, now that they're having to do these really big leaps into virtual learning, it has got to be a big challenge for individuals. My daughter has started a new job that she's away from home, and I'm keeping 2 of our grandchildren, and one is actually goes to private school, and he does traditional learning. They have very small class, I think about 5 students a class, so they've been safely social distancing, and I have to say I'm very comfortable with what the principal is doing around making sure that they stay safe and wash their hands and those kind of things. And they're fortunate to be able to have a very small classroom. And then I have one that is doing virtual learning from home. And it's a challenge, and especially if you work, if you work and it is a huge challenge, because you got to have that structure there. And then you have to, what do you do if you're a parent at home and you're challenged with the work that the kids are? And believe me, it doesn't matter how many degrees that you have. Sometimes this lessons is like, oh, I need to refresh myself. A lot of times when I'm sitting with my grandkids, it's like I gotta study the work before I sit down with them for homework.
Right. And so that's why we were saying there should be some guides included in the packet for the parents. Something need to be sent to the parents so that they can help. They can look at it, and then they'll be able to help their child as best they can. And one of the things that we are not wanting parents to have to be off the job for a year. That's why we've been pushing so hard to let the parents and students stay home. Let them deal with it for the first 8 weeks, while you, the district, get your house in order.
I want people to also go to the JPS website, and there, Miss Thea Faulkner, who's the director of the Parent and Student Center, and there's a link there for that particular department. Link to that department, and there's a lot of resources there that's available to both teachers and parents if you need help. I know they've been doing some training for parents and teachers, but if you ever are stuck and you need assistance, no matter what it is, please reach out to the JPS. If you're in the JPS school system, reach out to that website and go to the Parent and Student Center, which is Thea Faulkner is director of, and I'm sure they can connect you with various resources. They're still very actively engaged. They're actually on site every day working So make sure you reach out to them if you need help. That center is full of resources that are not only through the school district, but they have been connecting to many community partners who are providing a lot of resources to help both parents and teachers and students be successful during this pandemic. So please make sure you reach out to there. If you have any questions also, please email mail, M-A-I-L, at womenforprogress.net, mail@womenforprogress.net. We'll be glad to also help you get connected with resources and information if you cannot successfully get that information on your own. Or text us at 601-259-6770. Not only we will connect you with Ms. Bender, but we can connect you with Ms. Thea Faulkner and others, community resources that you might need to be successful. Also, a lot of parents are dealing with what do I do, with child care
Right.
and after school care and those kind of things, because for many of us, we have to work. So if you need some help around that, please reach out to Women for Progress, and we can connect you to some resources to help you get that accomplished also. So we want to be a source of support. Ms. Bender, I want you to stay with us a little bit because we might have another question for you if you have a time with us tonight. And I want to move with Ms. LaWanda Harris, chairwoman of the Jackson Municipal Airport Authority. And she's also an RN, which is also a group of individuals who are on the front line in such a major way. So welcome, Ms. Harris, to the program. How are you doing?
I'm doing great, Willie. Thank you so much for inviting me again on your prestigious show, I must say. You are a great voice in the community, and I want to thank the Women for Progress for they've always supported me in my commission on the board. So I thank you for that support.
Thank you. And before we get into talking about, I think we want to let your volume down a little bit in the back.
Okay.
Or if you got a phone, you might have a phone that's near you. If you can just move that phone away, and that way, yeah, there you go. That's better.
Okay, so is the volume okay?
Yeah, that's good now.
What about now?
Yeah, I think we're okay now.
Okay.
Good. Now, I want to first talk about a little bit before we move into our conversation on authority about nurses that have been on the front line. You have been in the nursing industry for a very, very long period of time. How are our nurses doing? I know I hear lots of times that some of the nurses are even leaving this field. So how does that impact us long term? Because we know we need nurses. We need them more now than even ever, with our loved ones to care for, and of course in our hospitals and our clinics. So tell me how nurses are doing out there.
That's a good question, and thank you for asking that question and being concerned about the frontline workers, such as the nursing profession. Yes, it has changed the profession tremendously in a drastic way. There have been nurses who were close to retirement that has decided to retire because of COVID-19. It is a virus that has just swept the nation and the world. So you have a level of fear as a healthcare provider. You still have a fear for your well-being and health. And keep in mind, we have caregivers, healthcare workers who have struggled with their own health issues. So a lot of those healthcare workers have made some personal decisions for themselves. But on the other front, the ones that are still on the front line, as myself, we weren't as fortunate to make a decision to retire from the profession altogether. And I do love what I do for others. So you just approach it different. The main thing that we are more concerned about is the hospitals and institutions providing safe PEE for us. And there have been cases where they've run out, and yet we still sign in for a shift, and you're still expected to work that shift. You know, if you don't, it's job abandonment or it's patient abandonment. So you have ramifications. So you feel sometimes, some of them feel that they're just kind of unprotected by their institution or their facility. But for the most part, hospitals and facilities are trying to provide, as to the best of their abilities, capacity, for their healthcare workers. One thing that has been put in place is that we do regular screenings. You're going to do regular screenings because we've got to protect the public. So as healthcare workers who are on the front line and engaged in taking care of, we have to make sure that we are not spreading the virus to the patients. So that's a major change. It's almost as if, like with the flu vaccine being put in place to control the spread of the flu vaccine. Well, the COVID-19, I don't know how long we're going to be with this, but it's not going anywhere right now.
That's right.
And there's too many unknowns. So what has happened is a lot of the hospital units, inpatients, have changed to COVID units. 25 beds, 30 beds of just COVID patients. So that alone is frightening for that healthcare worker.
Yeah,
so
she's she's walking right into war every single day.
Absolutely. It's almost like I said, you know, with my loved ones and in conversation, it's like you're stepping on a grenade if you're not prepared and equipped to go in there. So, you know, to work on those units, you actually need your protective gears. You're going in rooms where patient who has a known case of it, and you have to take care of it. So the nursing care has changed. What I mean about that is that we now do what we call target care, which means you only spend a certain time in that room. You target, you're not, like the rounding that you do on regular patients, hourly rounding, that's not the case with our COVID patients because it is airborne. And some rooms are not negative pressure rooms, like the rooms that they have for tuberculosis patients and all. Those are the rooms that we're using for the COVID in the hospital. So it has changed the way we look at healthcare and nursing care. So we have to, if we're not healthy, then we cannot help the patient. So we are very, very conscious of ourselves and being protected and not taking anything home to our loved ones and family members.
And also we have to you have shared a lot with us about that impact to our loved ones. You talk about targeted care. So even when you're in a hospital, you're not getting the care that you would have normally got before, pre-COVID. So we as a community need to understand that too, as our loved ones goes in and out of these hospitals and facilities. That is just amazing to hear about. But I'm hoping one of the things that comes out of COVID for the nursing industry and the healthcare industry, that we learn the need and also the value of our healthcare workers. Wages have been dropping instead of increasing for CNAs, for personal care workers, and for RNs. I can remember when RNs got top salaries. So across the board, we have dropped that particular wages and salaries for healthcare people. And now we understand, just like teachers, Dr. Bender, that we now know these are our most precious caregivers and our most precious providers of essential services. So I'm hoping one thing that comes out of here, but you know it's not going to be automatic. We as a community have to make sure we advocate for this. We have to let our leaders and our policymakers remember what you all are going through, both in the nursing and teaching profession, so we can keep that in front line and center and make sure we continue to remind our leaders that we need, as we move forward, to increase these rates. Medicaid specifically, who pays a lot for care, for in-home care for seniors and elderly and the disabled, Medicare it has to increase what they're providing on a cost level, so local providers will be able to pay these folks the money that they deserve. Like you said, you're putting your lives on the line every day, and
your family members.
Yes, and that requires a comeback pay. You know, you got to pay them for the work. So thank you so much for sharing that. Now let's move to the airport authority. We know that they're also, when we thinking about COVID-19, our airports have been impacted. A lot of people are not traveling because of safety issues. What's the status at our airport? Have we what's going on there, and has this slowdown impacted the revenue that's coming in there and our ability to make sure that we keep that airport alive?
Thank you for that question. First, if you will allow me, I just wanted to say to my fellow commissioner, I always like to recognize the Jacksonians, the citizens that I work closely with in governing the airport. And that is, we have 4 commissioners that are serving at this time with 1 seat vacant. We have Vice Chair Robert Martin. He's a licensed pilot with experience in aviation management. We have Pastor James L. Henley Jr., who has also serving as a reappointment. This is his 2nd term on the board, and he is finance. His background is finance, and also he is an attorney. Mm-hmm. And then we have Commissioner Wright. He is retired Lieutenant Wright of the United States Army. Also has a background in pilotry and military experience, and they all bring a lot to the table as it relates to governing the 2 airports. Now, as far as COVID, yes, it has definitely impacted revenue. Now, I talk general about revenue, but I would love for our CEO, Paul Brown, to come and give you a perspective from operations. So I usually just come from the governing side and just give you a general outlook of how the state of the airport is. Mm-hmm. Now, keep in mind, our airport, we govern 2 airports. Jackson has 2 airports. That's Hawkins Field, that sits in the heart of the city, of the metro city, Jackson, in Hinds County. And we have a commercial airport that's Jackson Medgar Wiley Evers International, that is in Rankin County. So that is where our commercial service are at that airport, and it has taken a big impact as far as revenue. However, we are thriving with the assistance from the CARES funding that was awarded to us during this COVID crisis, and it's to help us for expenses. It is restricted funding that is strictly to bail out the airports. So this funding is strictly for operation and expenses and to cover debts. Mm-hmm. In saying that, yes, we have kept up with the CDC guidelines and complying with the CDC guideline. We've aligned ourselves with the airline industry because we're working in cohorts together and co-syncs to keep the traveling public safe. So for the last 2 months, JMAA Commercial Airport, which is Jackson Meggers International Airport, has seen a significant increase in the leisure traveling. So they're coming back slowly, but surely. And to say, and one of the key things to the traveling public coming back in our airport is that we are the largest in the state. And we're sitting in an advantageous location. And so by us being the largest in the state, that gives us a little a heads up, a jump on the other airports around the state. Now, all the airports in the country are struggling to bring air service back. So in saying that, the month JMAA reports 13 departing flights, which is the highest number of departing flights at JAN since COVID-19 began and the impact in the air travel. Our flight loads are now at 50% in the frequency. So we're coming back slowly, but surely. We still have our legacy carriers, Delta, American, and United, who has been committed to servicing our community. Now, as far as the CDC guideline, yes, we have aligned with the airlines to protect the traveling public. Some of the things that we have instituted in our airports, and that is Hawkins Field and Jan, are the hand sanitizers throughout the Jan and Hawkins Field airports. So we have health and safety signage and announcements, reminders throughout the airports via social media. So you'll see that on our social media, a lot of cautions, a lot of reminders to the general public about the CDC guidelines, wearing your face mask, keeping your social distancing, washing your hands. Now that's very important. You can use hand sanitizer all day, but at some point you have got to wash your hands 20 seconds, warm water. That's what kills microbes, germs, viruses, warm water. So let that water run until it gets warm and really hot as you can stand it with soap on your hands and wash your hands for 20 seconds. That is the key to keeping the spread of viruses and germs under control. We have floor decals on the floor to distance each passenger or customer so that they can be reminded of the 6 feet distance. Got plexiglass in our areas everywhere around the airline tickets counter and car rental panels are plexiglass. Those are some of the things and tools that we've put in place in compliance with the CDC guideline. So that is for both of our airports as in reference to the COVID-19. Like I said, we have the face shields and all of that. So that's what we are doing. We're in consent. We're in sync with the nation as it relates to the airport industry and aviation.
Well, I know you have to leave us just shortly, Ms. LaWanda, but I want to ask this final question because I get it a lot from folks. Do you think we'll ever get Southwest back or airlines similar that provided those types of discount rate opportunities?
I'm hopeful. I'm hopeful because COVID-19 is a game changer. You know, even though we've had a hit to the industry, there's still an opportunity there, particularly when you're seeing international flights have decreased. And that was one of the reasons that Southwest chose to pull out those smaller markets is because they had changed their model and they're going international. So you don't have much international flying anymore. So I'm sure I see them moving back into smaller markets again in the country.
Yeah.
So I'm hopeful that Jackson is on their radar.
Yeah, and I think that will be a great opportunity for them. Well, thank you so much, Ms. Harris, for coming on. We appreciate you continually keeping us updated on what's going on at the airport. And we want you to be safe. You're, like I said, an essential worker as an RN and working with all of your various nurses and healthcare professionals. And we continue to pray for you that you stay safe. And look, pat on the back for all the work that you all do for us. Thank you so much.
Thank you, and thank you for the Women's for Progress for being a voice of the people and the community and for women leadership.
Well, thank you. Thank you so much.
Thank you.
All right. So now we're going to go, before we bring in our Health Matters, I want to talk to Ms. Rogers. How are you doing, Pauline?
Doing great.
Look, I appreciate you so much. You're always engaged with us and Women for Progress and the supportive giving of your time and your talents, and I appreciate all the work and service that you do. But before we get into our conversation with our Health Matters, you got an event that's coming up Saturday, I believe, that is just amazing. So tell us about that, and so our community will know what's happening and how they can get engaged.
Well, we have always, for many years, Criminal Justice is one of our platforms, do a summer camp to children of incarcerated parents. And of course, everything with the pandemic has been impacted, and our traditional camps were impacted this year. And so we had like 6 virtual camps, with this virtual meaning families with the largest number of kids, because you couldn't get them. But we've always given them school supplies, every camp child, at the end of the camp. And so whether they participated in camp this year or not, which the majority didn't, we will still issue them their supplies. And we're doing that on Saturday in the parking lot of New Horizon Church in collaboration with the Eliza Pillars Nurses Association, the Black Pharmacy Association, the Black Medical, Dr. Cahey's, can't think of his name right now, Mississippi State Association, and other local physicians, and Women for Progress. Mm-hmm. We will be there doing census, sign up, and voter registration engagement. So we will be doing civic engagement on that day as well, Saturday, because this is a very important year. All of the years of voting are important, but this year we have many tickets. So that will be Saturday. And if we have children that don't have incarcerated parents, we will be meeting the needs of those needed children. And so we will be doing over 800 backpacks filled with school supplies on Saturday, and handing out individual packs of sanitizer wipes to these children.
Wow.
Every child will get them if they are in the car. And you have to have some guidelines. If the children are in the car, all school-age children will receive one. If the children are not in the car with the parent, then we will only distribute one per vehicle. It's the only fair way we know to do. If the children are there, each child will get their own pack.
That makes sense. And this is almost like a drive-by safe opportunity.
Drive-by safe. Absolutely.
And also, we're going to be, like you said, Women for Progress will be there. We're going to be supplying you information also on how you can successfully complete and request absentee ballots for the November election. If you would like to be able to do that, we're going to share information safely on how you can do that. You don't have to get out of your car. We're just going to give you information on how you can get connected, how you can connect with our organization. If you want to send out a reminder, be sent a reminder to vote, because sometimes we get busy and we have full plans to vote November. So we'll be able to, if you would like to, very easily, we're going to pass you out a very little short card that has all of that information on it. And so you can connect with us for that information. We, of course, want to give you registration information if you want to get registered. We will even have notaries there on site, so they'll be able to help you. So we want you to help you do whatever you need to do to make sure that you have access to the ballot in November. So this is a wonderful event. And Pauline, I didn't hear the time period for this event on Saturday. Will you give that time again?
We're going to kick off at 9 a.m. while supplies last.
Okay.
Starting at 9 o'clock, 9 a.m. in the morning.
So people come early as possible, and make sure that you get the supplies that you need, and also the information that we're going to have there for you. So we appreciate you, and this is going to be a very safe event. And so, but those who are behind the wheel that pull up, we want you to have your mask on too. So make sure you do that. And we want everybody to be safe, and we will make sure that you're protected and that we're not touching and rubbing hands and all those kind of things. So we're excited about this event. We're so excited to be partnering with the Reach Foundation, who does incredible work, Ms. Pauline. So come out and be blessed by this particular event. Now,
and I also want to say this real quick, Willie. If they got family members, loved ones, or you just know somebody that's sitting in the county jail, pretrial detainees they are eligible to register and to vote. Please get the word out. And even if they have a felony conviction, if they just reach out to us we can tell them whether they are felony disenfranchised from participating in the democracy of registering and voting.
That's wonderful. That's wonderful, Ms. Pauline. Thank you so much. And Dr. Thompson, we want to definitely give you our last few minutes to talk about. I'm not sure what topic we're covering tonight, but I know it's always good. And so we give you the floor.
Well, it's right on time with what everyone's talking about today. And, of course, the news that we've all been talking about is COVID and how to help people survive. And ironically, I'm glad to be on here, Dr. Bender. I was listening to you all from my phone until I could get in. And so she was right on point with what I wanted to talk about tonight. And it's about teachers, being supportive of our teachers and students during this time, and understanding that they do need our support as a community as well during this time, because this is new for all of us, everyone, for parents, for teachers, for the students, administrators, the tech people. I'm sure at all of these different schools are probably in a whirlwind trying to make sure students have what they need and teachers have the support they need. And so I wanted to talk about mental health during this time, because it's so important that we understand it is a stressful time. It's so many new things happening, so many different moving parts, not only for the teachers, but also for the students, the parents, and those administrators who have to really weigh the burden of, am I making the right decision for my school district? You know, how do I navigate this system in a healthy and productive way with the least resistance and with the least amount of casualties? We don't want anyone left behind in the process, but we want to make sure all of us come out safe on the other side. And so I wanted to just leave a few tips for our teachers and students and parents during this time, that it's okay if you don't have all of the answers right now. It is okay. But what we need to do then is find out what are those questions we need answers to, and how can there be supports around what you need. And so do not feel overwhelmed or feel that you're all alone in the process, because there are parents who want to know how they can help in this process, and also who need assistance. But in balancing this act, you know, to remember to still take time out to carve out some time for yourselves, teachers. Take some time to really take care of yourself, do some self-care, and maintain your own mental health. It's so important that you can't give out of a reservoir where you're empty, where you don't have to give. And so it's so important that our teachers are being refueled with positive affirmations. So this is where parents can come in and send those positive emails to the teachers and just say, you do a phenomenal job. I thank you for what you do. And I think now more parents are realizing the importance of teachers, because they didn't realize how much teachers really did until now, when they're now being parent and teacher.
Right.
We would have a semi-vacation from 8 to 4:30, and then we just had to parent until bedtime. And so now we're realizing that we have to do this throughout the day along with teachers and help to support them. And so making sure that we kind of, you know, stroke our teachers and give them that encouragement that it's going to be okay. If the Zoom goes down, which happened today for us, we all had to just say, okay, calm down. Let's breathe 10 seconds. And then let's just send an email and say, hey, we got knocked off. Can you let us back in? And so I think that as much as we can, just stay calm in these situations, understanding that we will survive it. We will get over it. And then also take some time to move away from the computer. In that time, think about how your normal day would be. If you were in the classroom, you would have your planning period, or that period where you will be able to kind of debrief and kind of have a moment. Take that time still for yourself so that you can recalibrate, rejuvenate. You know, maybe take a moment to just 5 minutes, get away from the computer to walk, even if it's just around your house, whatever you need to do, but to disconnect for a moment. Because now we're finding ourselves, for students and teachers and parents, is that we wake up in the house and we're in the house. And so we're there for a long periods of time. And now that we're in front of these social media platforms, we're sitting for longer. And we don't want people to become too stationary. And also we have to warn ourselves about eye conditionings and making sure we're protecting ourselves with so much media time as well. So I really want our teachers and students to really practice getting up and moving around and taking that time for physical transitions. And then last, and then I'll take some questions, is self-compassion. Love on yourself. You know, we teach and we give, and as teachers, you give a lot. As parents, we give a lot. But self-compassion, that same positive talk you give to your students, give it to yourself. Be okay to give that same positive talk, that self-talk, that growth mindset. I can do this. This is going to be a great day. We will move forward past this. I am doing an excellent job. My students are meeting their goals. I'm meeting every expectation and succeeding in it. So having those positive talks for ourselves also helps make the day go better. And have reasonable expectations. This is only day 4. Only day 4 for some school districts. You're just starting. So be mindful that of your expectations that you're setting. We're in a pandemic, you know, and we will be here possibly a while. So in this, I always remember this old song. It says, please be patient with me. So be patient with yourself. Be patient to take time for yourself and understand that this is a growth curve for yourself. It's a growth curve for the parents. It's a growth process for the students and even the administrators. It's a growth process for them, making sure that they're making the right decisions. And so we can expect that, you know, we need to be patient with ourselves. And that it's okay if that day didn't go quite like we imagined. But that's where those expectations of positive thinking come back, and just really maintaining positive times with the students that you do have, connecting with them. And we understand that our students may be missing some of those social connections. And so I just had a few tips that if at any point that you do feel these overwhelming feelings, don't just take them and put them to the side and say, oh, it's just part of this. You know, do know that there is help. There is support. I even went out today to look and see what did the insurance plans for the state of Mississippi cover. It does cover for counseling. It does cover for mental health support. And so do know that you do have the Mississippi Department of Mental Health hotline. It doesn't mean, you know, that we don't ignore when we have a headache or a physical condition. So let's not ignore those mental things when we feel those burdens of being overwhelmed and feeling that anxiety. So let's deal with those things and be okay to talk with others, because there may be other teachers who need to hear that they're not alone, and that the two of you can then be a support to one another. So really, this is a time where we really need to lean in on each other, parents, teachers, students, administrators, and community as a whole. So if you see a teacher, you see a student during this time, encourage them and let them know, great job. And we will get through it.
Well, that's great information. I want to say also to parents that are now that are teachers, and especially grandparents that are out there too, is that create you a very small village that you can talk to and share ideas of what worked for you, what did not work for you. You can share opportunities where you all can work together, you know, and think about innovative ways how to really inspire and develop your children and your grandchildren. I want to also tell you to Google King's Leadership Institute. Cassio Baptiste, which is one of the most incredible young men on the planet. Not only he's a good father, but he is just what I call an expert when it comes to mentorship. I have watched him talk to young boys and young men, and it's a talent. He has just been blessed with it. He has a virtual leadership institute that is going to be available for kids that you can use for after-hour programming. but they're going to be able to connect to it virtually. And he has and that's broken down with groups of, I think, 10 to 14, and then I think 9th to 12th graders. And he just has something amazingly wonderful and empowering. And I think it's at no cost. I mean, don't quote me on that, but I think there's no fee for it. But you can go, and I think we have a link with it on our Facebook page. But I'm telling parents and grandparents alike to make sure you go and sign up your child for that program, because then you can continue to provide leadership skills and after-hour programs through this particular program for your young boys and your young men. And I think he covers everybody up through age 24. So please reach out. I tell you, that's one of the best tips that I can give you this week is to connect with that program. Also, he is going to be doing a very small group of boys. I think we're looking at about 8 boys that's going to meet twice a week for after-hour school at the DSC Workforce Center down on 55 South. We're starting with a very, very small number because we want to be able to safely social distance. It's going to be 2 days a week because we know, yes, we're at a virtual age, but just getting in front of our kids to ask them, okay, what issues did you have this week? What can we talk about? And so he's going to be doing that with boys from age 10 to 14. He's going to start with just 8 first, and they'll go through a 6-week course, and then we'll start a new group. We are committed to safely distance them. Matter of fact, he's going to be sharing them ways that they can be not only social distance at that particular group, but how do they make sure that no matter where they're walking, at the Dollar General or Walmart or other places that they engage with other young boys and other children, how to make sure that they safely social distance. And what is going through a pandemic mean? He's going to share that with them so that as we move through the 6-week course with them, they become safer and safer citizens, but they also have leadership skills that's going to really inspire them and really keep them going. Because, yes, we need this academic learning, but we have to also continue to create leaders in our communities. Through this pandemic, we need to do. And I tell you, I love the program that he has in place. And it's a program that's been around for a very, very long period of time. It's tried and tested and true. And so you can have confidence, and I highly, highly recommend it. I have 2 grandchildren that I'm going to be enrolling, a 13-year-old and a 10-year-old, so they will both be in the program, and I feel very, very comfortable and safe having him part of that programming. So reach out to that. That's out there on our Facebook page. We'll try to put a link to it also on our website. But if you'll just Google King's Leadership, like I said, they've been around a long time, so it'll pop up and you can go in and put your child on there. And that launches in September. September, I think, 1 is when it launched, so engage with that. I also want to remind everyone that we are launching, again, we have started a series of conversations called A Dawn of a New Era. What's your next? And we started on July 19th where we launched this virtual presentation, and we were thanking all of our legislators and voters for helping take down the flag. And now we're in the process of getting it changed. And our next launch is going to be August 23rd. That's Sunday at 4 p.m. August 23rd, 2020 at 4 p.m. And we're going to be launching the Women for Progress Political Action Committee PAC. Women for Progress Political Action Community PAC. And that PAC is being pulled together, or has been pulled together, to help put more women in public service. And that's on all levels, not only in our Mississippi legislature, but also on our various boards, on our city council, wherever we need true leadership. We think that when we add more women to the table, more heels to the table, then we know we're going to have good governance and good leadership, and definitely policy that impacts families and communities and our Mississippi economy. So we want you to be part of that. We're going to have this official launch on August 23rd, 2020, but also we're going to be celebrating the power of the women's vote. The power of the women's vote. It has been increasing over the past few years. Women are saying that we need to take control of our institutions and make sure that we have good leadership for all the people. The statistics have shown when women are in leadership, they bring more people, diverse people to the table. So we want to get more women in leadership roles here in the state of Mississippi, and Women for Progress, which has a history of political engagement and empowerment. We are excited to be able to to add this new vehicle to our line of projects and assets. So that's August 23rd, 2020 at 4 p.m. It's going to be a very, very exciting virtual launch. It's going to be on our Facebook page. You'll be able to hear it also on our radio network. So you can go to womenforprogressradio.com. You can hear it there and find out what radio network we're on. It'll be on YouTube. But mainly we want you to tune in to our Facebook page, Women for Progress MS. Women for Progress MS Facebook page. There'll be also a link on our website at womenforprogress.net, womenforprogress.net, where you can click a little button and get us live also. And that's this Sunday, August 23rd, 2020 at 4 p.m. Launch-in is going to be a very powerful and inspiring event, and we want you to tune in for that. Miss Pauline, is there any more news? You're doing so much. Is there anything else you need to let us be aware of?
Look, I'm glad you asked that. When Dr. Thompson was talking, and she was talking about the incentives and encouraging, one of the other things that we're going to be doing Saturday, that we will have a group of girls that are focused, it's called the Southern Black Girls, where they will be getting little pledge agreements for people to sign on. Just one thing that they will do to positively reaffirm and affirm these kids while they're going through this. You know, it's just something that we're doing as an incentive for them. And also there's a guy who's formerly incarcerated, Maurice Clifton, who we were in association with about I don't even know if it's been a year ago, in a video went viral. He's coming to actually help us, but I told him to bring his banner. And, you know, just because people need to know who he is. He has a lot to offer, bring to the table, a lot of things that he did and got certified in during his incarceration period that needs to be heard and assimilated and distributed to people. So
I've had the opportunity to meet him, Pauline, and it's an incredible man that is doing wonderful things. You can tell after talking with him for 5 or 10 minutes that he is a man of integrity and a man that is committed. I'm so excited about what he's doing, even in his own personal life, helping support and uplift his children and his grandchildren. And he's an individual who was incarcerated for many years, but he helped individuals within incarceration. He inspired so many lives, and he continues to do that with the walk that he's walking every day in his life. And I tell you, he's just incredible. He's incredible,
and he will be there Saturday. And I told him to bring his banner, so it'll be displayed, and just so we can introduce him to some folk.
Yeah, good, wonderful.
So I'm excited, and thank you, Dr. Thompson, and the cafeteria just bust. I'm telling you, you have a village that are supporting you. And of course, I haven't talked to Willie about this, but I plan on doing something we do with Women for Progress to support the teachers even more outside of Theo Faulkner's work with the pie store. That's something that the community will do. And of course, I'll get with Willie on that. And
Miss Pauline, if you say it, we need to do it, we need to do it. You know, we believe in you and support you, and support all the work and what you bring to the table. And also you, Dr. Bender, thank you so much for being a longtime member of Women for Progress. And in leaving us today, you've been so patient with sitting in with us. Is there any final thoughts that you want to share with us?
Yes, thank you for asking as well. We will be sending out a survey on Monday to our teachers, asking them what are their needs in terms of workshops. What can we do for them? We have scheduled a workshop, I think it's the third Saturday in October, for how to handle stress. So that's coming up. But in the meantime, we've decided on that one. But we want to ask our teachers, what else do they think they could use from us, because we have a truckload of workshops that we can do for our teachers. We even did one for the seniors at Forest Hill just to test it out, what it would work with students on how to handle stress. And it was so powerful, to use your word, Willie, that at the end they wanted to know, are you going to finish this on Monday? Because this was a Friday.
Yeah. And look, and let us know when those workshops happen. We're not teachers, but we need to sit in on those stress. But I know I had to put up my hand about it. How do you deal with stress? And you can't get enough information regarding it. And I want to say too, as we build these workshops too, let some of these workshops just be kind of letting your hair down kind of a workshops, not even necessarily about how do you empower your academic or your career work, but how do you do me, how to best do me and care for me. And I think too, during this COVID, because we're limited, let's think how to do me small, not necessarily big. You don't have to go take a week vacation or those kind of big things. This weekend, I'm preparing a staycation. I've been hearing so much about staycations. I'm going to prepare a staycation for me this weekend. and right now, I got a list of hotels. I'm trying to figure out which one I want to go to, who has the great breakfast that I can get up on Saturday morning and be able to have me a good breakfast by myself. And I'm looking forward in the evening while I'm there at the hotel. What can I do in the evening for myself? So these staycation things are a great idea. Look it up, folks. I tell you, I'm excited about it, and I'll tell you about it maybe next week. But let's look for things that we can share with each other. Connect with friends. Wake up on Saturday morning and have a friend every Saturday morning that you can have a cup of coffee with, that you can relax. Right tonight, I'm sitting on my patio. You see the wood back, and it's been raining outside. It has been really pleasant just sitting outside and having this conversation with you all. So let's find ways that we can get out of, as Dr. Thompson said, get out of our routine and be able to relax and enjoy ourselves. So thank you all so much for joining the conversation tonight. Thank Ms. Harris for coming in and informing us on the impact of what's going on with nurses, and also our Jackson Municipal Airport Authority. Again, I want you to tune in on Sunday, August 23rd at 4 p.m. for our live launch of the PAC, and also a presentation on the power of the women's vote. Thank you so much, Dr. Thompson. You're always amazing as usual. Stay safe out there. All right. Thank you all so much. All right.
I wanted to just make one quick thing. If there is anything that we can do to support in the process of those mental health sessions or educational, or just anything that we can do as Magnolia Medical Foundation, please do not hesitate to reach out to us. During this time, we have been conducting some of these sessions with single moms and students, and just kind of looking at some things. And actually, the article was featured in the Time magazine a few weeks ago of some of the work. And so we're excited about it, because we are finding that people need these coping mechanisms, as you said, just to kind of let your hair down and be free. And once again, put your feet on the ground and just feel the ground. Just walk barefoot for a moment, whatever that is. And so just being able to reconnect with nature and yourself, and to find yourself and remain to be true to yourself during this time. And so whatever we can do on that, please do not hesitate to let us know. And I just have to give a shout out to Cassio Baptiste. I am a very good advocate for that program. My son did his program many years ago, and so I love his work and what he does. And so actually we just talked yesterday about some of these great things. So he is a phenomenal man, and if you do have a young boy in your life or a young man in your life, he definitely needs to be in that program. So I ditto everything that Willie said. She didn't miss any mark about it. It is an on point program, and we do need that and other mentorship programs. So I'm glad Ms. Rogers has programs for women and young girls, because they do need our touch. At this point, although we can't physically touch, we still need touches me so much, and they help to fuel us and keep us going.
Yeah.
So that's my last remarks, and I always enjoy being with you ladies. And again, thank you for the opportunity to share.
Thank you. And can you give the telephone number for the Magnolia Foundation and a website or email address?
Sure.
Thank you, Willie. I was about to ask.
Awesome. The phone number is 601-613-3737. And the website is MED, found, FOUND.org, medfound.org. But please give us a call, and we'll be glad to support in any way that we can.
Thank you.
All right. This has been amazing, ladies. Thank you so much. This has been Women for Progress Radio. We'll see you back next Thursday at the same time. Thank you, and have a wonderful evening.
You are.
Thank you.